CEA numbers?
My CEA is negative. So I have no CEA. So there's realistically, if you looked at my bloods, I definitely shouldn't have stage 4 bowel cancer.
And so that's one of those things that, and as not being a cancer patient, I didn't understand, but I thought, hey, I'm going to my primary care physician and I'm getting, blood tests every 6 months or a year, and they're checking for all these numbers. So I'm getting checked for cancer. And a lot of people get a false sense of security thinking that they've been tested for cancer when actually they're only looking for the cancer markers, and there's no screening.
Exactly. Yep.
That goes
so
on.
I'm, riddled with cancer. Like I got a big tumor burden and I had a negative CEA, less than 5, So that, that just shows, all that says is, hey, this guy's got a cancer that doesn't make CEA. That's all it says. It doesn't say that I don't have cancer, which is, and so particularly even as family physicians, we can get stuck in that sort of pictures where we go, hey, we'll just check a CEA just to be sure, but you have to be really careful and clear in your thinking. If it's positive, it means they have cancer. But if it's negative, it means nothing. That's not the end of your investigation line. You then work them up. And so that's something I teach when I'm teaching, because I do a fair bit of teaching. That's something I teach. It's really important to know how your test works and what it tells you and what it doesn't tell you. That's up to us as doctors to own that. But patients being aware that a test is not always black and white, but almost every test that I know of, bar a couple, has a wedge of grey. And some tests that wedge of grey is enormous, and some tests it's really narrow, but there's always a wedge of grey.
That's awesome, man. I think that's what we have to look at, is that gray area, and that's where most of us cancer patients fall into. Is that
especially us young ones, especially people under 45. We are really grey. Yeah, exactly. Hard to diagnose, and
I've yet to find someone our age. I've yet to find someone our age that hasn't been misdiagnosed.
Yeah, absolutely. Yeah. No, because it's just not in the forefront of physicians' minds. So I'm hoping to do, when COVID stops and we can do conferences again, I'm hoping to do a presentation to general practitioners in Australia about my story and how it works. But that's later.